Well, first off, thanks everybody for joining. But I wanted to start with sharing just a bit of my personal story of why I started Elation and why Elation really cares so much about helping drive forward the DPC movement. You know, some of you might have heard some of this around the founding story of Elation, but getting into healthcare for me and for my co-founder and brother Kyna was really a chance of birth. You know, my dad was and still is a very passionate primary care doctor. We were born and raised in Canada, and one day he decided he was going to move to the US, where he felt he could deliver higher quality care to his patients and really have much more personalized relationships. And so ended up in the US, basically tasked as a teenager with figuring out the US healthcare system and why it was dramatically more complicated than the Canadian one. And so kind of early on, very much exposed to the complexity of healthcare and really wondering why it needed to be so complicated for a doctor to just care for a patient. And so, you know, we came down here, set up a practice for my dad, helped him, you know, build furniture, hire staff, inevitably negotiate with insurance companies, the whole 9 yards. I did that for about 10 years, and we were on that journey for over 20 years. You know, ended up building up a successful practice, great patients, really living out the dream that I think my dad had in mind when he moved down here, being able to really care for his patients in a deep way. And a few years ago, 3 years ago, after much encouragement from myself and Kyna, we actually moved the practice to a hybrid membership practice after being inspired by seeing so much of what the DPC community has done. And so, you know, it's just had a transformational effect on the practice, just the ability to have focused time with patients, focus on innovating in primary care rather than always chasing the next kind of administrative hurdle or requirement that shows up in the insurance-based world. Anyway, I wanted to share a bit of that personal story because, you know, the major thing I've learned from that experience, you know, working in my dad's practice every day on the front lines was really just the power and the sanctity of the patient-physician relationship in healthcare and just the immense value of having a doctor that you trust. And direct primary care is all about empowering that patient-physician relationship, returning healthcare to actually caring for patients. And that's why I think it's so important. And that's why Alation is here to drive forward the direct primary care movement along with all of you. And we're excited to play our part. And so today I just wanted to, you know, reflect a little bit on what has happened, or what we've seen happen over the course of 2020, and just do a little bit of a look back. And just to give you guys a brief update on Alation, we've been really privileged to continue to grow and humbled to be serving thousands of providers and millions of patients across the country. And just this kind of deep desire to continue supporting independent primary care across the country and really staying true to those roots while enabling high quality care and high quality relationships. That continues to be what we're focused on. And so I thought we'd look back a little on 2020, and this picture is apt since I think many of you are in the trenches day to day. And, you know, and there are so many joyful things that still have to happen, need to happen, are happening, but in the broader context of a lot of challenge and difficulty that's happened with the pandemic this year. So what we ended up seeing, I want to share with you guys some data here. So COVID hit the overall community hard in March, and this is data pulled from our community. I think it's not surprising to any of you. You know, we tracked 30% weekly declines in inpatient visits. it's really taken 4 months to near recovery, and in large part thanks to telehealth in terms of overall visit volume. That's kind of the trend you're seeing there. It's a massive dip in March, and then slow up climb after that. And I'll show you on the next, in a couple slides, what we've seen in terms of telehealth really driving a lot of that uptake and driving patient visit volume back. One interesting thing we noticed is that this graph, which maps the interactions with patients outside of visits, so not just the traditional encounter, but if you look at messages between patients and doctors, emails, phone calls, etc. These interactions really peaked in March. I think that was right when the pandemic hit, and right when I think there was a lot of question and concern around people have a lot of questions about their own health and really wanted to understand what was happening with COVID. And we've seen those interactions just continue to grow by over 20% and continue to sustain. And I think it really reflects the philosophy and the alignment of a model like direct primary care. You know, for a typical fee-for-service practice, this growing graph that you see on the screen, they're not getting any additional reimbursement for, explicitly, you know, do not get paid any fees for this service, and their revenue curve actually looks much more like the prior slide, where they're just getting paid for actual visits. And so what we saw is this increase in interactions with patients outside of visits. And for the most part, what we've heard is that the recurring membership fee structure in the DPC model really protected practices from some of the most severe financial hardship we saw in other parts of our community. And on the DPC front, we even heard some folks asking about seeing Medicare patients or trying to see other patients in the community, given the hardships being faced by more traditional practices. So this is something we saw in the community, and I think really speaks to the value of a model that's just so aligned with caring for the patient and meeting their needs wherever they are, whether it's you can see them in the office or you can't. So I alluded to this slide a little bit earlier, and this is the one around telehealth visits and virtual care. So obviously, with the pandemic, the need to socially distance and an incredibly infectious virus out there, virtual care, and the need to be able to engage patients outside the four walls of the clinic, being able to provide care without actually having to be in physical proximity, it's now more important than ever. And interestingly, we've seen a massive increase in virtual visits in our DPC community, 7% increase, and it's really sustained since March. And from our perspective, from Alation's perspective, virtual care, seeing patients virtually is no longer going to be optional. Like, patients are going to ask for it. That's the experience they want to have. They've had it before. And I see the DPC community as being so well positioned to provide this wonderful benefit and wonderful way to interact with a doctor. One thing that I wanted to kind of highlight in the presentation today is we've noticed an interesting trend within the DPC community where the number of total visits, and this is inclusive of telehealth visits, the total number of visits are still just at 80% of pre-COVID visit volumes. We noticed this as a trend and have been asking ourselves, is this sort of reduced visit volume a new normal for DPC practices? And you could imagine that being the case, in that visit volume, whether it's telehealth or in person, those are synchronous visits, and you could be communicating and delivering care asynchronously with your patients, and that could be much more of a dominant way of interacting with patients with more convenience and with more flexibility for communicating when people are free. Maybe it's, you can leave a message at night and be responded to in the morning. So really interested in this plan, found it of importance to highlight, and something I'd love to dialogue with you guys on. And then just wanted to highlight a few things from 2020 on the Elation side. We have been really hard at work trying to support the community and be as agile and flexible as we possibly can, and really adapting to where you guys are, what you're experiencing. One of the things we were really excited to do is offer free HIPAA-compliant Zoom, fully integrated into Elation for our customers to support virtual care. This is something, very much aligned with our belief that virtual care is not optional. We want every practice in our community to be able to offer that as a benefit to their patients. And we also launched, kind of in that vein, patient self-scheduling, the ability to schedule online anytime that's convenient, and intake forms as well to create just this enhanced patient experience. And we want to continue to work on that and build out more of those capabilities to enhance the experience of your patients. We also spent wanted to be there for you guys during COVID, providing that support, even going outside the areas where we're typically interacting, providing advice on, the loan programs, the PPP program, guidance on operations, clinical best practices, really trying to use the experience we have from across our entire community, identify the best practices, and really feed those back to you guys so you can feel supported and be able to take those best practices and put them into action in your practices. And finally, we've launched increasingly these interactive learning sessions with Alation team members that have been well attended, and we want to continue to do that and continue to be present there for you. And in that vein, just running ahead to some of what we're planning for the direct care community in the coming weeks and months. We've created a newly dedicated direct care team. We'll be reaching out to folks in the DPC community proactively to introduce themselves and make sure we're supporting you the best we can. We're going to be doing an AMA town hall next week for the direct care community. Really excited, myself and my co-founder and brother, Kyna, and we're going to be there to chat and are really excited to chat with all of you. And finally, our community forum, really want to encourage you guys to join, chat with other Elation providers as well as Elation team members to just engage in dialogue, share best practices, and share feedback. We're really honored to be your partner in driving forward direct primary care. It's, as I mentioned at the beginning of my presentation, something we feel really passionately about, something we think is so powerful and so important for our healthcare system, and we're looking forward to continuing to work with you guys. Thank you so much. It's great to be with you, and feel free to contact me directly. Here's my email if you need it. But looking forward to talking with you all soon. Take care.